We now know that mask wearing will be mandatory as of grade 5 for students in Quebec going back to school, but they won't be in these so-called bubbles as previously planned by the government. So let's have a look at the science behind some of these decisions. I'm Annie Demelt for the McGill University Health Center's MUHC TV. I'm joined now by Dr. Jesse Papenburg, who's a microbiologist and pediatric infectious disease specialist at the Montreal Children's Hospital. Thanks for joining me.
Oh, it's my pleasure, Annie. Thanks.
So first, let's have a look at mask wearing as of grade 5. Why that cutoff, 10 years old? What does the science tell us about how younger kids are affected or how they transmit the disease? And why are they, in essence, better protected against it than possibly older children and adults?
Well, one of the first observations during the pandemic was that it seemed that kids were very rarely affected compared to adults. And part of that may have been a bit biased or by the fact that young kids, there's a large proportion of children, perhaps up to 50%, that remain completely asymptomatic. So these are children that may have been infected and never sought medical care. So the numbers at first looked like kids were not getting infected at all. But it was in part because they just weren't getting tested because they weren't having symptoms, or certainly not symptoms that would require medical attention. So I think that's good news, and that remains true, that young kids have much smaller risk of developing severe disease requiring medical attention compared to adults, and especially the elderly. And what we've seen in Quebec was there really just been only a handful of infection in children, especially kids less than 10 years of age, that required hospitalizations. There have been very few hospitalizations in pediatric centers for SARS-CoV-2 in Quebec. So part of it might be the fact that we counted less kids as being infected because they weren't presenting with symptoms. But there's also a good reason to think that younger kids are also less susceptible to getting infected. So the virus binds to a receptor, and it needs to bind to that receptor to enter the cell and infect the cell. And we know that young children express that receptor at a much lower level than older kids or than adults. So it is possible that just because of the way that they express this cell surface receptor at lower levels, that young kids are indeed less likely to get infected. And if they're less likely to get infected, well, then they're less likely to transmit the virus as well.
The original plan was to have these groups of 5 or 6 students, these bubbles. Now the bubbles will be a bit larger. There'll be the classrooms, the groups of students in one classroom. And the plan is to try to limit interactions between those groups and other groups. So give us an idea of how that works. What's the rationale behind that? Is that a sound concept?
What we want is that when there is a case that's going to come up, ideally, you'd want that infected person to have been exposed to a smaller number of people. And that will allow for easier and quicker contact tracing, and also isolation of these group of exposed people from the rest of the institution or the rest of the school. There have been schools that have been able to reopen in other parts of the world, even during ongoing community transmission. And if you think back to what we may have learned from our own experience in Quebec, there were some cases that occurred in schools, and we're going to see cases occurring in schools. But we were able to limit it to a small number of small clusters, and we did not have any schools that were overwhelmed with an outbreak. Cohorting or keeping people in certain groups in which they're going to expose a limited number of people at one time, or they're exposed to a limited number of people at one time, I think that helps a lot in terms of limiting the spread to the institution as a whole.
What are you going to be looking out for? What are you going to be watching when schools reopen?
I think our experience at the end of the last school year was that as the community cases were declining and were at a relatively low level, we were able to open schools safely. I think really what I'm most concerned about is the overall spread within the community. When fall comes around, and perhaps later when the winter comes around, is there going to be an increase in overall community spread of SARS-CoV-2? Are there going to be increasing number of COVID-19 cases within the community? And that makes, as those numbers increase, it makes it, the pressure on the school becomes greater and greater, whether it be teachers, staff, kids, if they catch the infection in the community and then they bring it into school, it becomes harder and harder to keep these isolated introductions to a very limited degree.
It puts pressure on the rest of us to be extra careful if we want to keep our schools open. So thank you very much, Dr. Papenburg, for this.